All right. So, welcome back, guys. This is another episode of Conversation Sin Miedo. And I say this all the time, but I'm very excited about this episode because I have another special guest. But before we get into that, today we're talking about community resources, where to seek help without fear. So, pretty much in this community, what resources you could look into, what those resources are, and talk to Ricky today about what he does and talk a little bit more about what you can look for. And really, when I say without fear of like stigma, really without fear of being judged, and looking into some resources to help you with mental health. So, thanks again, Ricky, for joining me. And I know we have a your adorable baby too. So thanks again for both of you for joining. But can you tell me a little bit about you and what you do right now?
Okay, yep. So my name is Ricardo Osorio. People call me Ricky. I am a dual certified nurse practitioner, family practice, and psychiatric mental health. I strictly
Hmm.
work in mental health now at Tulane Mental Health. I served in the Army for 10 years as a combat medic. I was a prior
Hmm.
ER nurse, and I've done a lot of different things. This is my baby girl, Sophie. Growing up without a father, I'm kind of really just wanting to like normalize, bringing our children with us to everything, So if I go to meetings, sometimes I have my daughter with me, and and if she's not welcome, then I don't feel welcome myself, So I'm just kind of normalizing being a Latino dad, and I cook, I clean, I do laundry, and I take care of my baby.
Hmm.
I'm really proud of that, and not having a father, I feel like I'm really just really happy to be able to show what it's like to be a good father, And I have a son who's also
Hmm.
13, so yeah, that's who I am.
Yeah, that's totally awesome, Ricky. And I love that you brought that up. Um, like 2 episodes ago, I talked with a couple close friends of mine about like machismo and the struggles of that. And I don't know if you had a chance to listen, but it was talking about that and like gender roles. And I um I think it's super important that we, you know, everyone's open to their opinion of culture and what like gender roles they want to do or change or whatever. But I think that is important, like do what you want to do and what is important to you. So that's awesome. And um I didn't know that you said um in the army.
Yep, yep. I was a combat medic for almost 10 years. With the I
Wow,
was
over 10 years.
Yep, I was in the Iowa Army National Guard. Yep.
No, that's awesome. Well, thanks again for your service and all, like over 10 years. That is a really long time. So you were in Iowa, like you
Yeah, I got to
what
go to like
stationed?
I was stationed in Georgia and Texas, and I got to go to a lot of different places,
Mm-hmm.
like Alaska, where we stayed there training for a whole year.
Mm-hmm.
That was super cool. But yeah, while I did that, I studied and I worked at the hospital. So, I've kind of
Mm-hmm.
um, did a lot of stuff all at once. I studied at the
Mm-hmm.
schools. I went to West High. I studied at Western Iowa Tech. I went to Briar Cliff. I got my bachelor's and
Mm-hmm.
my master's from Briar Cliff, and then I transferred to University of Iowa, and I have a postmaster's
Mm-hmm.
degree from the University of Iowa in psychiatry. So yeah, that's
Mm-hmm.
what all my studies were.
Yeah, that's awesome. So, um, like we were talking earlier, I went to West High too, and I know I don't know, in our community, I remember my dad was like, "You can't go there. It's West High. It's like a like it was a very um I don't know, stereotype, like it's scary, like all this crazy things happening. And so I love that like we, have kind of similar background and we both studied at Briarcliff. And I
Right.
think it's important that whatever, I don't know, cards you have dealt, like you can um really make your own path. So yeah, that's super awesome. Well, you currently work at Siouxland Mental Health Center, right? So I know, so my best friend works there too, and she was telling me you guys have, um, like you guys get confused with Siouxland Community Health, right?
Yep.
Yeah.
Th-
So can you tell me a little bit about, well, really, that's the clinic, that's you guys kind of, you don't really work with them, right?
No, there's whole separate
Right.
clinic with their own behavioral health clinic. Yep.
Right, right. So talking about your position now, can you tell us about your role and really what really how long you've been working in community health?
Yeah, so I've been at Sule Mental Health as a psychiatric nurse practitioner for a little over 4 years now. Prior to that, I was working
Mm-hmm.
at Winnebago, kind of in their
Mm-hmm.
as a nurse practitioner there, and also at Rosecrans Jackson. And I used to be the provider at the Women and Children Shelter, where I would see a lot of the women that were there for substance abuse and then their children. So I kind of did a lot of the sick visits, like kids that were there for like sore throats, all kinds of medical
Mm-hmm.
conditions. I would see them. While I was doing that, I was still, getting my psychiatric degree. So then once I got my degree in psychiatry, I started working at Sule Mental Health, where I mostly we have some training in psychotherapy, but more than anything, I prescribe medication for psychiatric conditions. I diagnose, I order labs, and I order medications for all kinds of conditions like schizophrenia, bipolar disorder,
Mm-hmm.
ADHD, anxiety, depression, substance use disorder,
Mm-hmm.
all kinds of stuff. And our clientele is it's a very mixed clientele, and I really enjoy that.
Mm-hmm.
I would hate to work in a clinic where it was like the same thing every single day. In our clinic, we
Mm-hmm.
see private insurance, we see people that have no insurance, I see children 6 years of age and older. I see um,
Mm-hmm.
so I could go from a child with ADHD to a geriatric patient having, some psychosis to a young lady who just had some postpartum depression. And I really love to help the Latino community because I am bilingual,
Mm-hmm.
and I'm able to speak Spanish fluently to people about their, mental health conditions. I really like seeing a lot of the military people, so I'm part of the veteran care team. And then I also like to see the younger women that have like perinatal stuff. So I'm actually studying to get my perinatal mental health certification. I did schedule my exam. I won't say when,
Mm-hmm.
just at any additional pressure, but I will
Mm-hmm.
see if I pass. Will be also perinatal mental health certified, and I think I'll be the only
Mm-hmm.
prescriber in Siouxland that has that certification. So I'm pretty excited about being able to help more women that have problems in postpartum or during their pregnancy and
Mm-hmm.
continuing medication during that time.
Wow, no, that's really truly amazing. You've literally done every field, every age, like literally everything.
I try. I try and be able to help
So,
that walks into my office.
yeah, so again, that's truly amazing. And you bring up a good point about the Hispanic community and really that barrier in language too. But before we get into that, can you tell me a little bit about, so you said the certification you're getting, what is that? If yes, you'll pass, good vibes, you'll pass that exam, but um what does that role, what do you do with that?
Okay, so it's through Postpartum Support International. They have a great organization. They have a bunch of support
Mm-hmm.
groups. I recommend you check them out. They even have like a consult line, like if you're like postpartum or even if you're pregnant and you're having some depression, anxiety, there's people that you can call. You'll get a therapist or like a psychiatric provider that'll talk to you. Me, I can call
Mm-hmm.
them and ask them for help if I have a complicated patient. But I
Mm-hmm.
identified a need for that in Siouxland. And my we had a miscarriage prior to Sophie, so I also
Mm-hmm.
understand. And part of being a family nurse practitioner, I studied a lot of the other stuff when it comes to women's health. But I felt like there was a
Mhm.
need for a provider that could provide more services. So I kind of started investigating. I went to Detroit
Mhm.
last year for 2 day training, and then I did an advanced pharmacology training. And there's two tracks. There's one for prescribers like myself, and there's one for like people that are like therapists that don't prescribe medicine. So there's two different tracks, and you
Mhm.
have to have 2 years of experience before you can even like sign up for the course. So once I do that, then I will take my exam and I'll be certified. And that just means that I have
Mhm.
more advanced education and training when it comes to dealing with psychotropic or psychiatric medication in women that are pregnant or postpartum.
Mhm. Wow. No, I think that's definitely something needed. And you said if you get it, you'll be the only one in Siouxland,
As
like
far
in
as
the
that,
Siouxland area.
with this,
Right. Yeah. Right.
there is a therapist at the hospital, Megan
Mhm.
who has a certification as a therapist, but I think I'll be the
Mhm.
only person as a prescriber that will have the certification.
Mhm. So when you say prescriber, you prescribe medicine and
Yep.
right?
Mhm.
Yeah. Okay. Well, no, again, that's really, really awesome. I think that is definitely something, um, like I know personally some close friends that I think just the stigma too of like postpartum and even a lot of people don't know really the ins and out of it and how much it affects your mental health. Really, it's about your mental health and how much, you know, that process and everything, the not just the mom, but like you said, the couple and the family and everyone going through that is definitely needed and no, that again is really awesome.
Yeah, and then there's a lot of research that says that like men are equally, likely to become depressed during like miscarriages and because like we
Mhm.
during miscarriages, I felt pretty bad about it, but I felt like I had no room to say anything because I didn't go through the miscarriage. So I just felt like
Mm.
I didn't have the right to say anything or to say that I felt sad about it, but once I went to that training, they did a really good job of saying like it's totally okay to be the dad or the man in the relationship and say, "Hey, I
Mhm.
also feel very sad about this miscarriage, or this loss because we both lose the child, when that happens." So
Mhm.
it wasn't until I went to that training that I really understood that. So I think that also helped me in dealing with families and other, patients and their spouses, and just kind of normalize,
Mhm.
hey, it's okay to feel sad too. You don't always have to be the strong.
Mhm. Yeah, for sure, especially, I mean, as a partner too, you have every right to, feel sad, go through that grief, really. And yeah, you won't, like you said, have the same type of pain or whatever, but it's still definitely, um, you know, hurts and I bet it's extremely hard. So yeah, thank you again for sharing that. Again, that's um truly awesome. So later you'll do, sometime you'll do that exam,
Mhm.
right? Yeah, so good luck. Me and exams, and I know I have to do my um like state exam for my licensure, so I'm like, anxiety on that is
You said
real.
puede.
I know, just ponte las pilas. It's okay. Yeah,
Love
I
that
know.
saying.
We'll get through it. I know my dad would say it all the time, and I'm like, okay, like, yeah, easier said than done, but yeah, just positive vibes. So going back um to that mental health, you guys, I know there's a lot of services you guys provide, but um what are some like primary services? What are like the main things you guys provide to the community?
Okay, so we have a supervising psychiatrist. I think we have 7 or 8 psychiatric nurse practitioners, and we have one physician assistant who all of us are very different. That's what I love about it, that we're all very different.
Mhm.
So I mean, you can find somebody that really fits what you need. But we all prescribe medication. Then we also have a bunch of therapists that provide psychotherapy. We have a lot of therapists in the
Mhm.
schools, mostly Sioux City schools, that provide
Mhm.
school-based therapy. We have a crisis center that's open 24/7 to I think seven
Mhm.
regions in Iowa. It gets kind of tricky when we're this close to the border of Nebraska and South Dakota because
Mhm.
technically, Nebraska and South Dakota residents don't qualify. Um, and you have to be
Mhm.
18 and older, but we have a crisis center where we have like a subacute unit and we have like if somebody's having really bad depression, if somebody's like
Mhm.
suicidal, probably the hospital is the most safest place. But our crisis unit is
Mhm.
open for people that are just really struggling. We have nurses there, therapists there, and then if needed, one of us providers will get on the computer and meet them if they need medication or something. Um, we also
Mhm.
have urgent care clinic that's open, I think, from 9 to 3 most days of the week. We have one
Mhm.
provider who does it mostly, and then sometimes like I will cover urgent care or other providers, and that's pretty much like if somebody, you know, ran out of medications and needs a refill, or they just moved to the area, or they don't have a provider and they just really need something right away. We have urgent care spots open for anybody to walk in and obtain services.
Mhm.
And then usually they'll come in and then we'll get them on the schedule to see somebody like myself or another provider.
Mhm.
Um, we have the Friendship House. Friendship House is a place kind of on Court Street, kind of close to our main clinic. Um,
Mhm.
it's a place where like adults with like
Mhm.
psychiatric conditions can go and just kind of hang out. They get a free lunch,
Mhm.
they can play pool, they can play card games, socialize. There's a cat there for like emotional support. We have community support services,
Mhm.
are great specialists there. Um,
Mhm.
they help people apply for food stamps, housing, transportation assistance. I mean,
Mhm.
they just do a lot of great things. I refer almost everybody to them. We have IHH, which kind of is like integrated home health, and they just kind of really help with a lot of different things also, like getting somebody into a group home if needed, kind of coordinating appointments, and just kind of they do a lot of great things, all the case managers. I still don't always understand exactly what they all can do. But so I would just kind of always refer them and let them explain what they do exactly. We do have a be his worker who is kind of she internship under me, and I'm really pushing her to get her
Mhm.
master's degree and become a therapist because I think she'd be great. And she's also Latina and speaks
Mhm.
Spanish, so I'm really pushing for her to get involved in like Latino communities services that we provide around here, and then just going to school to get her therapy um, degree because I think she'd be great at that.
Mhm.
What else? We have a pharmacy in our clinic where sometimes we get grant money from like the federal government or other programs. And sometimes like if patients can't afford their medicines, we'll help cover the cost of medications. We have sliding scale programs. Um, we do a lot of injections in-house where patients that need injections for like antipsychotics, we will provide them there. We have a lot of court order patients that are, court ordered for services. We do lab services, like a lot of new patients, I'll get labs on them just to make sure that everything's medically okay before we prescribe meds or if we continue meds, because some of them are dangerous,
Mhm.
So, um,
Mhm.
I think that's it. There's a bunch of other stuff we do. We have a a child and adolescent clinic by the mall where we have a lot of
Mhm.
therapists and providers there that are specifically for children. So yeah, I mean that's off the top of my head, I think that's all we do. There's probably some stuff I'm missing, but I think it's a great organization.
Yeah, for sure. Like pretty much every, like you said, every population you serve, from like kids to like the aging population, and um you have bilingual therapists there, meds, like really a lot in the crisis center. So pretty much every building is around the Sioux City area. And then your main clinic is on Court Street, right?
Yeah. And then I guess I should
Hmm.
specify too that I see all the boys that are in juvenile detention. So all the boys that are in
Hmm.
juvenile detention, I will see them if they need like medications. And then my counterpart,
Hmm.
JD, she will see all the girls that are in JD. And then I also see a bunch of kids in a group home in Storm Lake via telehealth typically. I used to go there in person, but
Hmm.
then that contract changed. So I see them via telehealth.
Hmm.
And then so we have contracts with different groups too where we do that kind of stuff also.
hmm so you kind of work in So I know you have different locations, but where do you primarily work? Like, what's your location?
Well, I was at the child and adolescent clinic 1 day a week, but
Mm,
based on the people that I see, a lot of them live more in the downtown area, which is like your lower socioeconomic population. Not
mm,
always, but so it just was
mm-hmm,
better for me to stay at the main clinic. And because I see a lot of
mm-hmm,
corridor patients, it's just easier for me if they need their injections or
mm-hmm,
the pharmacy's there. So I'm there every day, except Wednesdays. I don't work on Wednesdays. I get every Wednesday off, so it's kind of nice.
mm-hmm. Yeah. Okay, awesome. So pretty much all the different offices in the area, they have their own, like the crisis center, kind of specifically what they focus on. And then, yeah, I know that child advocacy center, was it? Or the child
Child and adolescent.
office,
Yep.
adolescent, right, right. So that one's kind of closer to the mall. I've seen they was like recently built or
We have
recently
like a play therapy
open.
room, and we have like an art room and a music room and
Mm-hmm.
stuff. Yep.
Awesome, awesome. So I work at Heartland in South Sioux City, and I am a school-based therapist. So I go to the elementary school, so I work pretty much with kindergarten through fifth grade, and that's really my um. So I go to, I kind of alternate my days throughout the week with the elementary schools, but that's where I am. But really, with Siouxland mental health, they have different really it's huge. It's a lot of services, a lot of different therapy, a lot of different services you guys offer. So
Yeah.
that's really great. Again, of I know it is hard that even with us, we are, literally across the bridge in Nebraska though. So I know it's like all the insurance and it I don't know
And
why it's so complicated.
I'm licensed in Nebraska too, so I see a lot of people from Nebraska.
Mhm. Oh, that's awesome. I'm only licensed in Nebraska, so not Iowa, but hoping, later again with my um test anxiety, I'll do that later, But no, again, that is really great. So much really from school based to the crisis center, different offices really. And then I know you guys have an office in South Sioux too.
Oh,
So
yeah, I forget about that. We just opened up an office in South Sioux. Yeah.
right, right. So yeah, a lot of different services, a lot of different like populations you guys serve too. What do you think are the biggest barriers people face when trying to access these like mental health resources in our community?
Yeah. So that's a hard one. So like honestly, Latinos have been
Yeah.
the hardest population to get them to continue taking their meds or get them to start taking meds.
Mm,
And a lot of times, I ask people like, oh, if your pancreas was not working properly, would you take medication for that, like in diabetes?
mm-hmm,
They're like, oh, yeah, yeah, yeah. Okay, so then like, if your heart was, having problems and you had high blood pressure or an irregular heart rhythm, would you take medication for that? Yeah, yeah, yeah. Well, then if your brain is not working properly and you're having depression and anxiety, would you take medication for that? And then they're like, oh, and usually they're
mm-hmm,
like, I know they want to say yeah, but then, because they it just people think it's different, and people will take medicine
yeah,
for everything else, but then when it comes to the most important part of our body, which is the brain, I think, in my opinion, because without our
mm-hmm,
brain, nothing else really works, and people
right,
were just hesitant to take medication, and I try my best to explain things and side effects, but then sometimes when I explain
mm-hmm,
side effects, it scares people, and then they don't want to do the medication because I told them that they might gain a little
mm,
bit of weight, and so it's
mm-hmm,
kind of like it's like a slippery slope, and I've been really working
right,
on getting people to do what I want them to do without me telling them, right? So like really
mm,
working on like motivational interviewing and like really working on convincing people that this is the best thing for them without me saying it to them because it
mm-hmm,
doesn't matter what I tell people. If you yourself don't want to do something, you're not gonna do it. So I've been working
mm,
on convincing people that this is good for them so that they're more likely to do it and stay on the medication until a remission of symptoms or
Hmm.
when symptoms are no longer occurring, and then we can safely get
Right.
on medication, But people, unfortunately, I think a lot of people want a pill that'll fix everything right now, and think
Mm.
it doesn't work that way, But there are a lot of great people that do, take their medication. And I always preach
Hmm.
therapy is good, medicine is good, together more effective, But if you're doing one or the other, I'm
Hmm.
okay with it. So, like, if you don't want to take medication, then at least please go to therapy, because therapy is
Hmm.
so good also, and they can do the same thing as medication, so. But I think doing both is the best thing, right? Going to psychotherapy and taking a medication for the appropriate
Hmm.
condition, of course.
Right, for sure. I 100% agree too. I like it's that barrier, and when I say like just educating yourself on like trying it or like figuring out what works for you. Like maybe not like if you need a medication, something that isn't, I don't know, like a high dosage, like when like for me, I know when I spoke with a psychiatrist, they were like, well, let's start small, because I was hesitant too, because I'm like, well, I don't want to,
Yeah.
it's kind of scary because, yes, it's like, those commercials of like medicine and it's like all these like side effects and it freaks you out.
Yeah, yeah, it is scary.
Um, but I mean, yeah, you have to try it and you can't like, I saw that too. It's like, okay, you kind of have to find the balance and yeah, like I always plug in therapy and it's like, well, try it and see if this helps and then meds and kind of the both will definitely, you know, um, kind of work better together, really. So, yeah, I think it is hard with, again, that um, kind of that fear too, but also um, that barrier of just the stigma behind mental health. I think that's just the huge thing too of, well, I could do it myself or I don't want help or I don't believe in that, things like that, that it's you're right, it's your brain. It's literally um your um everything that you do comes from your brain. And it's super important to take care of it. Just like if you broke a leg, it's like, oh, walk it off. You broke your leg. You gotta, I don't know, go to the doctor, get a cast, whatever. So yeah, I think it's especially important, and I could go on and on, but yeah, definitely, I 100% agree that it is um, something you have to try, and what works for something might not work for you. What works for you, might not work for someone else. But figuring out um, really that balance will definitely help in whatever your goal is, what you're looking for, and yeah.
And there's a lot of
So.
there's a lot of fears too of like, oh, I'm gonna get addicted to it or I'm gonna get dependent on it.
Mm.
I try and do a good job of explaining the difference between addiction to a drug versus, becoming, dependent on a medication and what that means depending on the
Yeah.
medication, and that, yeah, it's a complicated process. And there's still that whole
Mhm.
machismo, in our community. And I really try and kind of break that because like I grew up with a mom, I became a nurse, like I used to get teased a lot for it, but hey, we do a good job, and I feel like I'm a great father because of it, and I'm a great husband
Mhm.
because of it, and I feel like I'm all around better person because of my lack of machismo. And it's okay to be that, but
Mm.
sometimes, it's 2025, you gotta get past that and kind of
Mhm.
you can still be a strong Mexican man and cry, and I
Mhm.
encourage everybody to cry in my office, and I think crying is good, and I tell my son to cry, and I
Mhm.
cry all the time, and there's nothing wrong with it.
Mhm. Absolutely. I again, I'm so glad you're a guest on my episode because I think that um is very true. It ties in with everything, and we grew up, and a lot of people did grow up of, you have to be tough, tough it out. Don't ask for help because you're seen as weak and you're, seen as you can't do it. But it's um it's like, why are we so hard on ourselves? Why are we so like it's kind of hard working with my littles that, explaining to like someone in kindergarten or second grade, like, well, would you be mean to a friend or tell them, they can't do it, so why are you, mean to yourself? And so it's kind of like that. You have to, break it down. So, um, so I think we kind of went through everything, but I was just gonna ask, what do you feel um, like what advice would you give to someone hesitant to seek help due to this cultural stigma, or really just anyone kind of hesitant? Like what advice would you give to them?
Um, that's a good question. There's a thing that I always tell my patients, and it says, 7 times down, 8 times up, right? So like no matter how many times we fail, or no matter how many times we struggle or go down the wrong path, you just have to get up that one
Mhm.
extra time, So if you had so many depressive episodes and you feel hopeless and you feel like you've had all these bad relationships that all go bad, just not to lose hope and just stand up again, So doesn't matter how many times
Mhm.
we fail, how many times we fall down, you just got to stand up one extra time and keep fighting.
Mhm.
And we have a lot of great services in town. I wish we had a Spanish speaking therapist in our clinic because, a lot of people just come and talk to me because they can speak to me in their language, but I'm not.
Mhm.
I focus more on medication, right? Like I'm not really
Right.
got a lot of supportive therapy, but they need a psychotherapist, and I wish we had more in this area.
Mhm.
We have a couple, but I wish we had one in our clinic. And
Mhm.
obviously, when you use translation services and uh, you know, phone lines or iPads, like
Mhm.
so much is lost in translation, and it's so hard for me to talk to you and be like, "Oh, can you tell her that I feel so depressed because of this?" Like you just lose
Mhm.
person to person connection, and it just is not as therapeutic.
Right.
I think one of the questions that you didn't ask me, but it was on the questions you forwarded me, was how did I get into this?
Mhm.
When I was still in the army,
Mhm.
I was part of what's called the honor guard, and we did a lot of funerals for military members, and a lot of them were like older gentlemen, older service members that died from natural
Mhm.
causes, but there's also a bunch of suicides, and that's kind of when I started
Mhm.
thinking like, whoa, like there's a lot of young people, killing themselves, and like why is this happening, and like, and you'd see the
Mhm.
families and how much hurt they had, and I started thinking about it, and then working in the hospital, seeing all these Latinos and just all these other patients that would
Mhm.
struggle. And I would tell them, go see your psychiatrist, go see your psychiatric provider, go see your mental health provider. And they're like, well, I can't speak to them in my language, or I can't get in for 2 months.
Mhm.
They don't listen, and I was like, God, somebody needs to do something about this. And I guess eventually
Mhm.
I got tired of saying somebody needs to do something, and I found myself signing up for school again, and here I am, and I feel like some days are really hard, but man,
Mhm.
there's some people that are doing so much better, and those are the ones that you really celebrate and you know, keep me going up, showing up for work and enjoying what I do because I know that some people are better because of them coming to see me and trusting me with their care
Mhm.
and listening and doing everything they're supposed to, right? Like eating better, exercising, taking their meds, stop using
Mhm.
drugs, going to therapy.
Yeah.
Yeah. Sorry, that's a long answer to your question. So,
No, I appreciate it. And yes, thank you for reminding me. That was what I was gonna say too. Like um you have so many different things that inspire you. And again, like you said, it's kind of hard, and especially right now and everything going on of like you um sometimes it's like, okay, who's going to stand up, who's going to do the change, and sometimes it has to be you. Sometimes you have to um like going back to school, and it is hard, and tests and studying and everything. So yeah, there are times where it is tough, and I mean, I've only been doing this a couple years, but yeah, there are those moments where like the good outweigh the bad kind of, and you think about like, yeah, there's tough times and there's
balance.
kind
Yeah.
of with everything. Yeah, you have to find the balance of like, yeah, there's going to be, there's bad things in the world, but there's also good and bad things happen, but there are rewarding things and like these little steps, these little goals we have to celebrate too and just like the big goals and um so definitely that is extremely important too. Um but I think that kind of ties it all together. I mean, I hope in the future if you want to come on another episode, I'd appreciate it. But I really enjoyed our conversation today, and we talked about what your role is, the services you provide, and the agency you work for, and some community resources, and just some different things of someone that if someone's hesitant to seek services to kind of remember that, like um, what might work for someone might not work for you, but finding that balance, figuring, kind of educating yourself on what, like if you need help, what that looks like. And um, again, like thank you for everything you've done. Like you're truly inspiring. And like you said, you're a dad and literally all that on top of everything and everything you've done. Thank you again for um, truly everything in your time. So I appreciate it again. Thanks, Ricky, and thanks for joining me with your baby. I appreciate it.
Thank you so much for having us.
Yes, thanks again. Well, our next episode we will um have another guest, and like I said, there's a lot going on right now. I don't know, just not exactly with the Hispanic community, but just in our community. And we're gonna talk about that with someone from Union Action. So please look out for that, guys. And thanks again for listening and take care of yourselves. And I appreciate you all. Thanks again.